Hi, everyone. Welcome to the 2025 Health Equity Fund application webinar. My name is Shalita Drabaugh, and I am the Health Equity Fund Program Officer for the Richmond and Henrico Public Health Foundation, which was founded in 2021 as a 501c3 that supports the Richmond and Henrico Health Districts, or as we refer to them as RHHD, as you'll see on this slide. The foundation supports RHHD's work through flexible nonprofit fundraising and a more nimble approach to innovative public health program development. So for the next hour, you will have an opportunity to learn about the background and management of the Health Equity Fund, investments made in the community since its inception, and the 2025 funding cycle, including details about the application, grant writing tips, selection process, and ongoing reporting requirements. We will save the last 15 to 20 minutes for questions. So as a reminder, please place your questions in the Q&A tab within the session, and we will get to those at the end. So the Richmond Health Equity Fund is the first program that was established under the Richmond and Henrico Public Health Foundation, with the leadership and support of Richmond City Council through an initial investment of $5 million of federal funding through American Rescue Plan Act funding, which we refer to as ARPA. Since then, the Health Equity Fund has built on the ARPA funds to create a new public-private partnership of local philanthropic organizations, corporate partners, individual gifts, and yes, of course, sustaining funds from the City of Richmond through non-departmental funding. So the Health Equity Fund is a locally led fund dedicated to investing in gap-filling health services and social supports, critically needed in our communities to challenge health inequities and strengthen health outcomes. Interestingly, the Richmond Health Equity Fund is the first of its kind in the Commonwealth of Virginia and the third in the country, after Boulder, Colorado, and Louisville, Kentucky. So how does the Health Equity Fund work? There are 3 different entities involved in the management and implementation of the Health Equity Fund, who all work together in the funding process. There is the Richmond and Henrico Health District, RHHD, the Health Equity Fund Community Advisory Committee, which we refer to as the CAC, as well as the Richmond and Henrico Public Health Foundation, RHPHF. So RHHD first serves as the chief health strategist for the Health Equity Fund. They're also the liaison to the City of Richmond. The health district staff provide administrative oversight, programmatic support, and technical assistance with monitoring and evaluation for all of our partners. The Health Equity Fund Community Advisory Committee, which is pictured here, a few of those community members are pictured here. They're community members who use their lived and professional expertise in health disparities to prioritize projects for funding and determine investments. The CAC's input is part of what makes the Health Equity Fund model so unique and ensures that our funding decisions are informed by the real needs of the communities that we serve. And lastly, the foundation. The foundation is the nonprofit arm to RHHD. My position as the Health Equity Fund Program Officer is the first and primary employee of the foundation, and I facilitate all of the Health Equity Fund processes. The foundation is governed by a board of directors who approve the new investments. They identify additional funding sources through strategic level planning, and they lead the overall direction of the Health Equity Fund. The goal of the Health Equity Fund is to decrease health inequities in Richmond and make measurable improvements in health outcomes through investments in community-rooted, gap-filling, evidence-based initiatives. So we understand deeply that residents in Richmond, Henrico, and the broader region face many of the same health challenges and systemic injustices. But the funding that makes the Health Equity Fund possible has been specifically allocated to Richmond and cannot fund projects in Henrico at this time. Therefore, activities eligible for Health Equity Fund funding must be focused on service or program delivery for Richmond residents only. The Health Equity Fund exists to address longstanding health disparities and disinvestment in communities of color, with an emphasis on 5 focus areas that are of deep concern to residents of those communities. And the 5 focus areas are access to healthcare and health education resources, chronic disease and underlying health conditions, food access and security, maternal and child health, and last but not least, mental and behavioral health. We have also built in some flexibility for emergent disparities that we may need to focus on in the future. Since our inception, the Health Equity Fund has awarded between $500 to $1 million per year to community-based projects. As you can imagine, the size of those investments, they vary. Funding is based on project scope and the potential impact of those projects that are submitted. Ultimately, there is no set minimum or maximum, which you will notice in the application, though the average size of awards to date has been $85,000, with the smallest investment we've made being $10,000 and the largest investment being $150,000. An example of an award made for $150,000 would be a collaborative of 3 different maternal and child health organizations who sought health equity funding to improve access to community doulas for families and training and certification support for those doulas. To date, the Health Equity Fund has invested over $3.2 million into 27 unique community-based organizations across these health disparity focus areas. And here's a depiction of all 27 amazing Health Equity Fund funded partners. If you're interested in learning more about their particular projects that were funded through the Health Equity Fund, please check out our website at www.rhphf.org/health-equity-fund. So as you all know, the Health Equity Fund opened its 2025 funding cycle last week and began accepting applications on March 3rd, with a closing deadline of March 30th. There will be no extensions of the March 30th deadline, so please plan accordingly as you are doing your applications. We encourage any single organization or collaborative serving City of Richmond residents across our health disparity focus areas to apply before March 30th, especially those who approach their work through a racial equity lens, demonstrate fiscal stability and sound financial management, those who maintain general liability insurance of at least $1 million, and those who have staff and board leadership who are reflective of the communities that they serve. Also, organizations who have previously received funding from the Health Equity Fund, you are eligible to submit an application within this open cycle if you are submitting an application with a new scope of work and you remain current in meeting your requirements that are specified in your contract. Please check out our website, which is displayed here on this slide, to learn more and to specifically review some helpful application materials, such as application guidance, which takes this webinar in a couple-page document to explain our process in detail. Also, the outcomes and indicators document, which gives you an idea of what the Health Equity Fund's goals are within each focus area, as well as suggested outcomes and performance indicators that you can include within your application. And last but not least, the frequently asked questions document that I will be updating after this webinar to include any questions that are not already addressed in that document. I've also included in this slide a direct link to the application itself. So please keep in mind that there is an opportunity for you all to get started now on your applications. You can save your form. If you need to pause and return to it later, it will give you a return code. So that is an option that I absolutely would recommend for all of you to partake in. So to better support use completing your application, we have incorporated within our session this year uniquely some grant writing tips. And we have, in partnership with our foundation's grant writer, these slides have been created. I am trying to confirm that the grant writer is on the call. I am unable to see her name on this chat, so I might move forward without her unless she can identify herself. Okay, I will move forward without her. But we are grateful for her support in helping to craft these slides and partner with me in enhancing you all's capacity to submit very strong applications. So some grant writing tips that Bianca and I thought would support this work would be ultimately to know your audience. Please leverage our website and familiarize yourself with our mission to promote health equity in Richmond and let that shine through your applications. Read the instructions carefully. As you noticed in the screenshot in the slide prior, there is detailed instructions at the top of the application that we would absolutely love for you to read. Also, for some of the application questions, you will notice that there are field notes under the application to also help you in completing your application responses. So make sure to read those instructions carefully and to manage your character limits, as most of the questions do have character limits, which you will notice as you review your applications. Also use clear and concise language. Avoid jargon or acronyms. Spell out as much as possible and utilize accessible terms. Be specific. Use some concrete details within your application about who you're planning to serve, how you're going to serve them, and what impact you intend to see. Also, please have someone unfamiliar with your work proofread it before you submit it. That is also a helpful way to make sure you put forth a strong application. Here are also some tips on how to tell your story effectively. So lead with your why. Explain the community need before describing your situation. Also include authentic voices. There you can incorporate testimonials or experiences from community members. Show your expertise in the work that you do. Demonstrate your organization's connection to the community. Balance your emotion and the data. As you'll see within the application, we absolutely want to see your understanding of root causes and connect that data with compelling stories and testimonials, as well as the statistics that back up your work. And be memorable. What makes your organization or approach unique? Here's just a quote from one of our funded partners, hopefully to demonstrate how they have told their story effectively, and we highlighted them in one of our bios, excuse me, in one of our blog posts. So now when we think about how are you going to demonstrate your evaluation plan? So as you will notice, as you walk through the application this year, you will need to select a focus area. We've already discussed what those 5 focus areas are. So for the sake of your time, we would love to share with you one example from a current partner of what their focus area looked like, as well as their outcomes. And hopefully this information is helpful. But ultimately, you want to ask yourself the question, how will my intervention or proposed scope of work support support the Health Equity Fund goals, essentially. So you'll select your primary focus area that will guide your application responses. And then you will identify the micro goals that are on our website for that particular focus area and align your work to those micro goals. An example of one of the goals that is on the website within the Access to Care focus area is improved improvement in knowledge of health status for the clients that are served. So this particular program sought to improve the knowledge of health status for their clients. And in doing so, they develop outcomes and indicators as such. So the next step would be to define a clear outcome. So what specific changes will occur as a result of your work? So clients, this is an example of a suggested outcome that is on the menu, which is available on our website. This particular applicant chose to utilize one of the outcomes, an outcome and indicator from within the menu. So the chosen outcome was they're trying to ultimately see clients increase their awareness of their own health. And how are they going to do that? They're going to increase the number of residents that have access to colorectal screening within a time bound, so within a year. Step 4 would be, once you have that outcome, how are you going to measure that? How will you know when you have succeeded? So they wanted to track the number of individuals that they screened. And so they tracked the number of testing kits they distributed to clients, and then they included a target, which you will see on your application, that we are asking you to include a target as well. And then an additional measurable outcome, they looked at the testing kits that were returned and what was the return rate. An example target would be 50%. So in the next step within your application is, how are you going to track these measurable outcomes? There are multiple ways to do so. You can utilize sign-in in attendance sheets. You can utilize pre and post surveys. You can utilize Facebook analytics if you're tracking targets as it relates to engagement. So there are multiple ways to collect data, but within your application, you're going to want to make sure you detail those for us as specific as possible. And also share with us what is your capacity in existing systems to calculate those indicators. So following the application deadline, which again is March 30th, the CAC will deliberate between April and May to set their priorities for funding and make selections for the foundation's board to formally approve. So based on those application responses, the applications that are submitted this year, the CAC will select organizations that work in the most impacted Richmond City communities, organizations that demonstrate a commitment to racial and health equity. They demonstrate a commitment to cultural humility and curiosity. They have community leadership and input. They understand the root causes. The CAC is also looking for organizations who are aligned with the overall Health Equity Fund goals, have a readiness to track outcomes, and have a unique funding need that is unmet by other sources. So during this deliberation period between April and May, the CAC may engage some applicants with clarifying questions if that is appropriate. So by June, the CAC and the Foundation's board will make a collective final decision of new projects to fund and announce those decisions to applicants. Once applicants are selected for funding, new partners will enter the contracting stage. This could take between 3 weeks to a few months, depending on the scope of work and how ready the organization is to detail the activities that they're proposing. Contract exhibits, they will outline the activities being funded, their projected outcomes and indicators for each activity, as well as a detailed spend plan for their award. So to assist partners in co-developing their contract exhibits for execution, the Health Equity Fund and Health District staff will work together with those funded organizations to review program details, financial matters, and contractual reporting requirements. After the contract is executed and an invoice for payment is received, the Health Equity Fund will disperse funds to selected partners according to the agreed upon schedule in the contract, which may involve the total award being distributed in multiple payments. Then the project can start. The funding period for this award can begin as early as July 1 of 2025. It's important during your application stage right now that you indicate your most impactful start date and your most impactful end date for your proposed program within your application so that we can ensure that your budget aligns with the projected timeline. All Health Equity Fund partners, they will have ongoing reporting requirements throughout their project period. So there's quarterly reporting that may be requested for updates on comparing your actual to budget spending of the funding that you received through the Health Equity Fund, as well as the status of your project and the progress that you've made toward completion. In addition to quarterly reporting, annual reporting is expected for all partners. Annual reporting, it will include actual project elements and progress made toward health outcomes that were identified in your application and in your contract exhibits. Some of those reporting elements will include the demographics of any residents that you directly serve, and that could be age, race and ethnicity, gender, household income levels, and their physical address, which will include their zip codes. Those are data points that will be a part of your annual report. The annual report will also include narrative updates on implementation progress, input from clients directly. So that could be anecdotal evidence, stories, photos, testimony, and also data reporting on specific indicators and outcome metrics that you will choose prior to finalizing your funding scope. So annual reports, they're due every year throughout your project term until your project closes. We will not ask for individual, personal, or identifying information from you through any of our reporting requirements, but you still may choose to collect that information for your own purposes. So this concludes the formal content for the webinar. And I will end the recording. And at this time, please drop your questions in the chat, in the Q&A, and we will go through that in a formal capacity.